Good afternoon, everyone. Thank you for joining today's webinar. MedHQ is the leader in back office services for surgery centers. During the COVID-19 crisis, they have been answering questions related to HR, and today want to share their expertise on the reopening of ASCs and the considerations and impact on HR. With that, I would like to introduce Tom Jacobs, CEO of MedHQ, and Rita Hernandez-Figge, COO of MedHQ. Tom and Rita, take it away.
Thank you, Lindsay. Welcome, everybody. Thank you again for joining our webinar today. A little bit different of a topic. We're not delving into regulatory language and that sort of thing, but now we're, like everybody, trying to anticipate what reopening might look like. So without further ado, just a reminder that we're coming at this from the point of view of HR practitioners. We're not attorneys, so we're not presuming to offer any legal advice. It's above our pay grade, as they say. But we're kind of taking things as we see them. Rita, I know, and her team are on the phone with people constantly talking about issues, how to reopen, in this case, all sorts of things HR. So we're really just kind of going at it from our perspective as people who've been doing HR for longer than we care to say. With that, here's the agenda we'll go through for the discussion. Throughout the discussion, you should have the opportunity through the webinar tool to submit questions. We hope we see a lot of questions. We should have time for them at the end. If we catch a question and it looks like it pertains to something we're talking about, if we're aware of it at the time, we'll try to insert it as the discussion goes on. Otherwise, we'll try to address all the questions that come in at the end. So please submit your questions. Without further ado, here we go. So the decision to reopen, as I mentioned, we're going to stay in our lane talking about HR compliance as our focus for the discussion. I think that's what you want to hear from us. Most of the cases that surgery centers perform are only elective, as we all have come to think about it. But I think we're all realizing elective is only in a limited sense. At some point, these surgeries become non-elective. And I think the country's realizing that, the government entities are realizing that, and so outpatient surgeries is a priority in terms of reopening. So here we are. Certainly the decision ultimately will be center by center, according to what's going on in your communities, and will be up to your board of managers really to decide. 1 second, sorry, here we go. Okay, so with that said, here's the situation. My staff is currently on furlough. What's the best way to share information about back to work planning and scheduling? So I bet a lot of you have already done this, but we would encourage more of it. And those who haven't yet done it, it's really a nice opportunity to have a town hall meetings. So reach out to your staff, give them 24, 48 hours advance notice to a town hall meeting. Lots of tools out there to do that, which I'm sure you've all used to connect with friends and family. Well, those same platforms can and we think should be used in a town hall environment. And the reason being, from an HR point of view, right, Rita, is that we want a consistent message to go out to everybody. We want everybody to feel included in the messaging and in the communication, and not leave anybody out.
And this is really important because I think employees want to hear from you. They talk amongst each other. It's best to get the information straight from their leader as opposed to getting information from each other, because something invariably gets confused or lost in the translation. So again, really important. You'll find that they can be a lot of fun. The employees will have questions. They'll want an opportunity to talk.
Yeah, and as a leader, you want to be on that, even visible on those conferencing tools. So show your video, show your screen. But we think also, this will be a way to alleviate some of the anxiety that's certainly building for everybody, for all of us out there. once they are able to connect with coworkers. So how do we bring staff back in a manner that's fair, unbiased by matters that are not job related?
So I think this is a critical topic, the non-job related. I think that your safest bet is to treat all employees the same. If the center is all open, you're going to assume that all employees are qualified and ready to be back to work. You are going to have some situations where people will have questions and special circumstances. If you decide that you're going to phase in your workforce, consider skill sets. So you want to be really even-handed about this. If an employee requests an accommodation, I can't start this week, or I'm concerned to start, work with a human resource consultant. And, you have a partner there. Work with a person who is really familiar with the new regs, and just a lot of things are changing. So make sure that you're having that communication. Also, share your reopening staffing plan early and often. These things will change just by the nature of what's going on. Surgery centers are opening, maybe not opening. State, community rules regarding when a center can open. You may be on the path for one direction and one set of dates, and then something happens and that date moves. So again, just when you have that town hall, make sure you're really clear that this is the preliminary discussion. This is our plan in the moment, so that these plans can change.
And I would say the plan can be very much of a highlight or milestone type of a plan. You don't need to dig into all the detail, but give the milestones. What's the date we're looking at, for example, as opening? Full or partial reopening. Some basic highlights like that. And while you're sending it to your staff, state right up front, this may change. Setting the table that, it probably will change. So let everybody be aware that, it's not fixed in stone.
So this next question has come up already several times from one end of the country to the other. I have an employee that prefers to remain on furlough and collect unemployment. What do I do? So you are having this conversation with employees. There are employees who are on furlough. Maybe they're making more money on unemployment. Maybe they have some other family concerns. So really, you don't want to delve too deep into what the issue is. You want to tell them that the center is open, that there is work available, and that because there's work available, unemployment will end. Now, employees may think that they, I'll just continue collecting unemployment, but, when those wage and tax reports go out, unemployment will catch up and require payment back. There are some considerations for, by state, again, this is all state specific, for partial or reduced hours employment. So if, in fact, you're bringing people in a phased approach, there might be an opportunity to work with your employee and figure out a schedule for that individual. But if an employer refuses to work, they are not eligible for unemployment. So I think that's something that you really need to deliver that message so that they understand that, once the center is open, the unemployment benefits go away. You have a job for them. So again, you don't want to be heavy-handed, but you do want to let them know that, ask them, are you quitting your job? Are you leaving employment? Because we are now open and we need your assistance. And I think that's really the way to phrase it with employees. You need them back.
Yeah, it's a very delicate matter, clearly in many situations. But it is something that needs to be communicated, clearly to the person who's thinking, well, maybe I'll just not go back at my, keep my own schedule, in other words. So, well said. What is your staffing plan if you have an exposure? So consider ways to segment your facility to minimize multiple interactions among staff. So one concept, right, Rita, that we've seen discussed is assigning teams, and there are various ways to do that.
Right, and then these teams continue to work together. So you're not mixing individuals from one team with another. So if in case, the worst happens and there is an exposure, these individuals are, because they're always working with the same people, it's easier to identify. So it's just something to keep in mind. You may have a better reason to schedule your people differently. Maybe, I've heard of some centers scheduling, because they're only open 2 or 3 days a week, they alternate the team that comes in on that day. So a number of different ways to do this. Again, this is probably one of the most challenging aspects, because ASCs are known for having employees who are cross-trained and being able to handle a number of different subspecialties and multiple specialties by individual, and this is an area that you probably want to take a very hard look at. Again, consider your workspace, your office space, your waiting room areas, and consider any adjustments to space that you may need to make so that, as people flow through your center, you are aware that the social distancing rules and all of that stay in place.
One of the phrases I've heard recently is we may, as the country kind of gets back to work and won't be a perfect situation, we may get into a mode where we're, right now we're very concerned about protecting everybody and protecting everybody from the virus, and which leads to protecting others from the virus spreading. It may go to more or incorporate some aspect of really protecting the vulnerable. And we'll get into that a little bit more as we talk about ADA and some folks who may be more predisposed to some very negative ramifications. But I think that goes along with how you plan your teams as well. Make sure you'll have fair allotment of assignments and things like that, and really protecting the vulnerable too, and accommodating as ADA would require those situations as needed. So what other staffing issues might I need to consider?
There's going to be a lot of areas that people will express concern to you. Make sure you listen to everyone's concern. People are, to use the non-technical term, they're a little freaked out right now. And so, be sure to listen to what people have to say. Make sure that they understand that, if you're bringing people back to work, that you do have the adequate PPE protection required to conduct business in a safe manner. But also make sure that you're aware of employee rights for emergency paid sick leave, the EPSL, and emergency paid family leave or medical leave. Both of these things may come into play, and you may not have experienced them yet because your centers were either closed, your employees were furloughed. While on furlough, none of these benefits applied. But once you reopen, there will be opportunities for these discussions to take place.
Remember, these benefits go through the end of the year, 12/31/2020. And, we've addressed this on previous webinars, but there are tax credits to help mitigate the cost of these benefits to the surgery center. Okay, so we're ready to open, but we have employees who are concerned about returning to work in light of shelter in place and potential exposure. What should we do?
Okay, so this is an interesting one because, we want people to be observant and practice their social distancing and practice whatever is in place. But once your center is open and conducting surgeries, you are considered an essential business. And so consequently, the employees are considered essential workers. Now, will there be a group of employees that can work remote? Probably, but those are all discussions. But if they're essential workers, you need them in the surgery center. They're exempted from shelter in place during work hours. So they are, very able to come to work. But take the time to explain your protocol for keeping employees safe and what PPE will be provided. Again, this is another area that we're hearing a lot of concerns from employees. And again, and we mentioned it before, and I'll mention it again, is consider phasing employees back to work. So if you don't have a need for everybody to be there at the same time, make sure you develop a plan that brings people back to work.
Okay, I'm sorry, just got a little bit, there's some questions about maybe not being able to hear. I'm just going to do a sound check real quick. Lindsay, you're able to hear, is that right?
Yes, I can hear you.
Okay, so I think we're good. Okay, sorry about that interruption. So how do we handle workers that have pre-existing conditions?
So this is another timely topic. Employers should accommodate employees who request altered worksite arrangements for remote work, and also if they have any underlying medical conditions that may put them at greater risk. But this is really no different than what you have done in the past for ADA accommodations. It's just thinking of this in a new light and remembering that this is all part of it. The EEOC's guidance on COVID-19 and the ADA note that accommodations may include changes to the work environment. So again, this has always been there as part of the ADA. What can we do to help you come back to work? So if that means that you have to provide a barrier or that a plexiglass barrier, or maybe some space between workstations. Do your best to accommodate these needs. The Age Discrimination Employment Act, so this is different, unlike the ADA, does not have reasonable accommodation requirements. Nonetheless, though, you really are encouraged to be flexible in your response. Listen to your employees, especially vulnerable employees, and if they disclose a condition to you, again, keep in mind that all of this information is confidential. You don't have to explain to others why you're making a specific accommodation, but you really want to make sure that you're doing the right thing for your individual employees.
And I think when you're doing your daily huddles or your weekly staff meetings or monthly staff meetings, and you're talking among your team about how you're going to, practically distance from one another, especially inside the surgery center, in the clinical areas, come together as a team and really kind of make that a topic of conversation in your huddles and in your team meetings, and get a consensus among your group about how you want to approach that, how your team can manage your social distancing. It's going to be kind of a normal course of how we work every day. Right. Within our surgery centers. It's going to be different than what we've experienced in the past, where these surgery centers, you're operating so quickly.
Right, and this includes places like, and the things that people maybe not have stopped to think about, but this includes anywhere where you serve lunch, you have a lunchroom or a break room. This includes a locker room. How do you want to phase those people in throughout the workday so that you don't have a cluster of people in these confined spaces at the same time? So again, we're asking you to keep all of these things in mind, especially, for individuals coming back with pre-existing conditions. This is a time of concern, heightened concern.
Absolutely. Protecting the vulnerable. That's one of the things I think we'll all be thinking about going forward.
So again, no conversation regarding the virus is complete without some discussion on EPSL and EFMLA. I mentioned it before, I'll mention it again. And this question has already come up. We were okay while employees were on furlough, but now I know that people are going to come back to work, and some employees have young children at home who are out of school. Schools aren't going back in session this school year, so it's a few months yet, and maybe even into the summer. Don't automatically assume that everybody with a child can't come back to work. Some will want to, but there is, the EPSL, employee paid emergency paid sick leave, and EFMLA for the care of children. So again, if they fit the requirements, the standard, we don't expect you to all become experts, so contact your human resource partner for advice and what the process is, but we'll help you get that paperwork processed for these individuals. So just keep that in mind.
And while the later FAQs on this topic that came out from the Department of Labor said healthcare workers would include any employee of a healthcare provider.
Right.
So technically, you do not have to grant EPSL, EFMLA, but in that same paragraph at the end of it, they said, but be, I think, judicious or be careful using that. So you want to accommodate people in this manner when you can, and in doing so, you're eligible for the tax credits.
Right. And again, once you start the practice in your surgery center, though, you will have to be consistent among all of your employees. So keep that in mind. And again, talk to your human resource folks about that, and we can help walk you through that.
Okay, I know we will provide PPE for our staff, but what do the relevant regulations say about responsibilities for a safe work environment in the presence of the coronavirus?
So this is a tough one because everyone basically says the same thing.
We have a few slides on this, just to give everybody a heads up. There are like 3 or 4 slides.
So OSHA says, okay, employers' actions will be determined based on employers' good faith efforts during the coronavirus disease. This is actually an amendment. So, this is a statement out there. They know that maybe some of the required testing or training may not have happened, but as long as the employer shows good faith effort that you're going to do this and catch everybody up now that they're back to work, this is something that you need to talk to your employees about. but also understand that there is some protection there. How does this affect, Joint Commission, CMS, HHS, state departments of health? Well, the Joint Commission continues to work closely with all of these groups and state departments of health. And the key thing is that as long as you can prove that you're trying to provide a safe work environment that includes appropriate PPE by job, you should be in the clear. But again, always be willing to listen to your employees' concerns. Workers' compensation. Now, this has taken a bit of a twist because workers' compensation typically has said anything that is virus related, so illness, flus, and the like, they're not considered workers' compensation claims. But that said, workers' comp is a state-by-state kind of thing, and many states are now loosening their requirements on this because of COVID-19. This is a really different kind of thing, and people that are the most susceptible to it are really those that are in healthcare positions. So because of that, and first responders and the like, that they're opening the door to file claims under workers' comp and occupational disease illnesses claims. So those are the things that you really need to, to take a look at.
Yeah, I'm going to go, we have some discussion here on this, I know in later slides or next slide. I just want to go back and reemphasize OSHA just for a second. OSHA, if they're concerned about one thing, it's, I'm just going to say it's a harsh topic, but it's when there's a death at the workplace, right? And that's one of the things that will really get the eye of OSHA for, traditionally it's going to be in a manufacturing or some heavy industry, construction, where these things are more, maybe more likely. So, clearly we're talking about that possibility of somebody contracting the virus. Now, we're not trying to scare everybody, but just know that you need to be able to show good faith effort that you're trying to protect your staff. That's really the critical thing here. And it's obviously practical. Obviously, everybody's going to do that, but make sure you keep your documentation. Make sure you think through it. Make sure you have your plan and your information together as you make your arrangements for protecting your staff. So, God forbid something negative happens in your facility from the virus.
So this is where it starts to get a little long and lengthier. So if after returning to work an employee comes into contact with a COVID-19 patient, what should I do? First and foremost, make sure you always have a copy of the latest protocol set forth by the CDC. And these have changed on a routine basis as they update and the like. But basically, CDC is saying is going to take into consideration whether the patient or the healthcare provider was wearing PPE, how much PPE, the extent of the period of exposure. So these are the CDC guidelines effective April 13th. They may have, been updated today. I don't know, but these things are updating pretty regularly. But it's really important for you to take a look at that. And again, the next question follows on the tail of what we were saying before about is somebody who contracts the virus. Is this a medical claim? Is it a workers' comp claim? Unless there's clear and direct knowledge that this person had somebody at home who was sick, most likely in some states now it'll be considered under workers' compensation because of the fact that this virus for healthcare workers and first responders is out there. So again, it also depends on the state. The state of Illinois just recently broadened their ability for healthcare workers and first responders to go ahead and file under both the Illinois Occupational Disease Act or under Illinois Workers' Compensation. And this is not, Illinois isn't known for being a trendsetter. This is going to be something that pops up in various other states.
And one way this may come about, what Illinois did is there's this thing called presumption. So they've for the next 150 days, there's an emergency order saying the presumption is that a worker who gets the illness got it at work if they're on the job, or even potentially if they're not at work but on the job, right?
Right.
So this presumption is the clause. So what's probably would happen then is the insurance carriers will battle it out because presumption means that the employee is presumed to have gotten it from work, but there is an opportunity for the employer or the employer's insurance carrier to contest that presumption. and maybe reverse that presumption. So that's one of the ways it could be battled out, so to speak, if it ever comes up in your surgery center. So what are the return to work rules for healthcare workers with confirmed or suspected COVID-19?
So again, this is where we refer you back to the CDC. So, there's two different ways to do it. There's a test-based strategy, which is the preferred method for healthcare professionals to return to work. And that says exclude a healthcare worker from returning to work until they have a resolution of fever without the use of fever-reducing medication, improvement in respiratory systems, negative results of an FDA emergency use authorized molecular assay, so basically a test, and then from 2 consecutive nasal swabs, and I'm not going to try the word, Tom is laughing, specimens collected 24 hours apart, not greater than 24 hours apart, so for a total of 2. So that's one way. If the test-based strategy cannot be used, and we realize that, testing is right now somewhat limited in areas. There are not enough tests out there. More and more work is being done to make sure there are enough test kits, but it's not happened yet. So if test-based strategy cannot be used, the non-test-based strategy can be used instead. And again, this is all in consideration for a healthcare worker. And in that case, you're going to exclude them from work for at least 3 days since the recovery of a resolution of a fever without the use of fever-reducing medications, improvement of respiratory systems, and at least 7 days have passed since symptoms first appeared. So you can't have an employee say, hey, I had a fever on Sunday, I'm taking off Monday, and I'll be back to work on Tuesday. It doesn't work that way. You actually have to count the days. So again, healthcare
workers, healthcare provider, by the way, HCP.
HCP.
We had to have that.
With laboratory confirmed COVID-19, so these are people who have had the test, who have not had symptoms, should be excluded from work until 10 days have passed since the date of the first positive COVID-19 diagnostic test. So again, these are all a lot of dates, a lot of things to keep track of. So your best bet is to pull up the CDC website and get your latest updates. But we'll be passing these out. We'll be distributing these slides. But again, things change very quickly. And if your healthcare provider had COVID-19 ruled out and they have some kind of alternate diagnosis, so for instance, they had the regular flu or something else, upset stomach, criteria for return to work should be based on that diagnosis. So a lot of you already have plans in place that say, hey, if you've been off more than work for 3 days, you need a doctor's note to come back. In some cases, that's going to be a little harder to do these days, but again, keep those in mind.
I'm sorry, one real quick thing on HCP, acronym city. Sorry about that, but I don't know my own acronym. So HCP, healthcare professional. So not to be confused with provider. Here in the healthcare industry, we all know healthcare provider means something typically, but HCP here means any healthcare worker, basically, healthcare professional.
So again, part of the requirements for somebody to return to work is for them to wear a face mask for source control at all times. So this is when the healthcare provider or professional, now I'm going to say the wrong word, is the person that we're looking at. So they're to wear a face mask for source control at all times while in the facility until all symptoms have completely resolved, or at least 14 days after the illness onset, whichever is longer. And a face mask instead of a cloth face covering should be used by these individuals for source control during this period of time in the facility. Now, there's also some discussion about, whether cloth face masks are appropriate in anything other than just regular settings. If it's over, I'm going to assume that is not the case. At this time period, these healthcare professionals should revert to the facility policies regarding source control during the pandemic. And again, a face mask for source control does not replace the need to wear an N95 or higher level respirator or other recommended PPE when indicated, including when caring for patients with suspected or confirmed COVID-19. Of note, N95 and other respirators with exhaust valves might not provide source control. So this has been, I think, a little bit of a surprise for some individuals. So keep that in mind. And again, these individuals should be restricted from contact with severely immunocompromised patients. So again, transplant patients, hematology, oncology until after 14 days after illness onset, and they should be self-monitoring for symptoms, and they should seek reevaluation for occupational health if respiratory symptoms recur or worsen.
Do we have to test every employee that returns to work?
In an ideal world, that would be yes, but this is not an ideal world, and there's no requirement right now to test every employee that returns to work. You should, however, have employees complete daily health checks, via questionnaire, or however your current process is. And again, employees should be counseled that if they're not feeling well or have a temperature, they will not be allowed to work until the issue is resolved. And then again, there's some special consideration in place for any employee who was confirmed with COVID-19 or suspected COVID-19, then they must get a medical clearance to return to work. We covered that on some of the previous slides.
And if we do decide to test, do we need to test everybody?
And that answer is yes. If you're testing everyone. You have to be fair.
All right. And what testing is appropriate? So everybody's tracking different sources. One we like is tracking the FDA approved test methodologies, and there are plenty of government websites out there, but this is a pretty good one. Okay, one other topic that we've encountered in the last couple weeks is repurposing your surgery center as a hospital department, especially in those situations where the surgery center is a suite within a hospital structure. We've seen that, at least even planning. Even if it doesn't happen, there are certainly efforts being made to plan in case that need should arise. So what does that look like from an HR point of view? If your team is staffing the surge facility, make clear who is in charge during the period that the hospital uses your facility as surge capacity. In reality, you'll never really separate your own management of your team completely from if the hospital is managing your team also. But just know who's the primary line of management in that situation. Is the staff reporting to a manager within the hospital or a director in the hospital, and then you're there as overseeing from your perspective the surgery center manager, or is it the other way around where you are reporting to the department, the hospital department, and your team works for you who works for the hospital? So just be clear on which arrangement that is. Are your staff properly trained? So in other words, how outside the scope of what you do normally day to day is this effort? And is your team being asked to perform things that are outside their traditional scope of concern? If there's an injury during use as hospital surge capacity, whose injury is it? Whose work comp policy? Again, if the employees are still being paid by your surgery center, then it's typically going to be your surgery center that is whose work comp policy would be in play. Make sure, however, you're tracking all those times and all that payroll wage to the appropriate work comp code. Communicate with your work comp carrier. Let them know this could be happening or is going to be happening. And for us, it was a conversation, and we made known it may happen, and we're going to report that cost or those wages under 8833 for those locations instead of the surgery center traditional code of 8832. There is going to be a higher expense associated with 8833, 2, 3, 4 times as high in some circumstances, depending upon your state and depending upon your carrier. And then factor those things in when you put together your service agreement between your surgery center and the hospital. You certainly want to be reimbursed appropriately from the hospital. Their cost is at this level, so it'd be expected that operating as a department of the hospital, your cost would be there as well. Lastly, I don't think anybody would try this, but don't try to do half days. You really want to clear differentiation from the time periods you're operating as a department of the hospital versus the time periods where you're under your traditional surgery center operations. So those are some of the thoughts we had about that. What HR resources are available to staff to help them cope with the demands and stresses that arise during reopening?
So most employers have resources within your benefit programs. So I think this is some time, if you haven't taken a look at it, you may want to do that. Employee assistance programs, EAPs, as they're commonly known, are typical features in your benefit program. So this is a great time to remind employees that the EAP is out there, where they can find the number, how do they utilize those sources, and remind them that it's all very confidential. So the EAP is out there for the employee's use, it's confidential, and it's a wonderful resource for employees to talk to somebody outside of, the people at work or their family about their concerns. In addition, a lot of EAP programs have free visits, so the first, depending on your program, 3 to 5 visits with a healthcare professional to talk to them about their concerns. And then most medical plans, if they didn't before, certainly have now implemented some kind of telemedicine and access to telemedicine. So you now have more doctors than ever, even your own primary care physician who's now practicing telemedicine. Some have a copay that's similar to a doctor visit, some don't, some are waiving the cost. So make sure you understand what your benefit program looks like and what it offers. There's also excellent third-party telemedicine providers that you pay a small fee for, and they're add-ons to your current benefit lineup. And again, employees can reach out and call those. For the most part, those programs, when you sign up for them, they're free to the employees. If they start to use some mental health benefits through that, they wind up paying. But for telemedicine, for actual diagnosis, I've got a cold, I've got the sniffles, is this the virus, is it not? Those telemedicine providers are just really great doctor visits. And again, I mentioned it before, but these telemedicine, it's grown by leaps and bounds, especially during COVID-19. And again, a lot of doctors are getting on board and make sure that your plans include telemedicine going forward.
I think it used to be, or most recently, even 2 months ago, there were fairly distinct things, telemedicine versus your health plan. The last 2 months have really squeezed those things together, where your primary care docs are on board with telemedicine, and that benefit through your traditional medical plan is probably available or should be available, and you want to look at that at renewal. And the telemedicine providers that are independent are getting more aligned with the networks that are out there, I think. Okay. Well, we made it through about 40 minutes, and I was hoping we wouldn't get here because the next topic is PPP loan forgiveness. And tell you what, first I'm going to look to see what other questions we have about the previous topic. And we'll get to this. I'm just joking, but I know we have a couple of questions that came in, so let's address those. Okay. Okay, if they can't come back to work due to childcare, since schools may not be open, do they switch from unemployment to FMLA?
Once the center is open, you basically have said, we're back to work. We have room for everybody. So yes, they switch into being eligible for emergency family medical leave.
Yeah, the EFMLA under the law passed about a month ago.
Right. Under the FFCRA, if you want for acronyms.
So it's not traditional FMLA.
It's EFMLA.
But it's EFMLA. Yeah. Again, that's through the end of the year.
Right. And the interesting thing about that is that there is pay during that period of time. So we can refer back to the slides from before, but again, the EFMLA is paid. The first 2 weeks are at no pay unless it's the employee's own need, but after that it's 2/3 pay.
And next question was simple, and these are the only 2 questions, I think. I take it that there are 2 more questions. The first one is, will we have access to the slide deck? And yes, you will. Lindsay and the team will be sending out emails providing links to the slide deck. And lastly, does MedHQ have boilerplate policies for return to work, PPE, self-monitoring signs and symptoms, etc.? It's too early in the game to have boilerplate, I would say, but certainly we're developing those, like I'm sure a lot of HR departments and a lot of operations are developing them. So, those will be, and quite honestly, I think it's a little early maybe for us to try to develop a boilerplate, because there's still guidance being written. There's still questions being asked and new answers being developed. So we're not quite yet to the stage where I think from an HR point of view, HR professional point of view, we would be comfortable with the idea of a boilerplate yet.
Right.
There's still too many facts and circumstances that we need to get our arms around it to know, to call it, to have a boilerplate type policy, I think.
Right, and the things that we've been focused on right now have been forms for claiming EPSL and emergency family medical leave. So those are some forms, but other than that, we do not have these boilerplates.
Okay, so we're going to try to delve into PPP loan forgiveness now that many have applied and maybe been approved and maybe even gotten your funding, and maybe others are still in the process of applying and trying to get approved and hoping for the next phase of dollars come in. I talked to our banker today, and she said they're sort of in a lull, but they see another tidal wave coming at them as they get ready to handle more applications. So whichever boat you're in, you'll have to think about loan forgiveness and how you would apply for that. This is the language right out of our documents. Borrower may apply for forgiveness of certain amounts under this note as set forth in the CARES Act. Typical provision. Borrower may apply to lender for forgiveness of the amount due on the loan in an amount equal to the sum of the following costs incurred by borrower during the 8-week period beginning on the date of first disbursement of the loan. So that's just as we thought it would be. You get the dollars, and then you have an 8-week, what we've been calling a measurement period, and that's the critical time frame that you're looking at, and you're going to compare that 8-week period from now, let's say, until I think June 16th is eight weeks from today. Those costs compared to previous. We'll get into the previous in just a second. But you're going to look at payroll cost, any payment of interest on a covered mortgage obligation, any payment on a covered rent obligation, or a utility payment. Pretty limited set of things other than payroll cost. And payroll cost, once again, it includes gross wages, it includes benefits cost, but it does not include payroll taxes, right? And it does if you paid somebody not emergency sick leave, but just traditional sick leave or PTO. It includes that cost. That's a wage cost. And if there's a severance, let's say an employee who terminates and there's a severance arrangement, it does include that cost as well. And also 401k and match or something like that includes that cost. Right. Did I miss anything?
I don't think so. I don't have any one in front of me, but I think you got them all.
Yeah. So those are the payroll costs you're going to calculate for this 8-week period. So the amount of loan forgiveness shall be calculated in accordance with the requirements of the PPP program, blah, blah, blah. Last sentence is the critical one. Not more than 25% of the amount forgiven can be attributable to non-payroll cost. So in other words, those rent obligations, utilities, the non-payroll things listed there cannot be more than 25% of the total amount that you're adding up. Okay, so next slide, we'll get into a little bit more detail. So there's a couple methods that were laid out in the law. One relates to number of employees, and the other relates to salary or wage cost. So you have two different methods essentially to look at, and you can choose. Okay, so the first one, number of employees, is really looking at number of paid hours because it uses a full-time equivalent employee. So you're looking at that, on an annual basis, 2,080 hours would be one FTE, I should say, in this slide. One full-time equivalent employee is on an annual basis 2,080 hours. So over an 8-week period, I don't remember. That's
that
is. But 52 weeks in the year plus a day, that's 2,080. So we're looking at 8 weeks. So 8 divided by 52 plus 1 day is essentially what you're looking at for a full-time employee, right?
Right, and this also, when they're talking about full-time equivalent employees, you're also adding in any hours if you have part-time employees and the like. All those hours go into your calculation to determine what your full-time equivalent employee is. So,
Yeah.
It may wind up with a fractional number because you're going to add in all the hours and then you're going to divide by 40 for each week, and that's your equivalency.
Yeah, so it's very common. We see it all over. You have 15 or maybe 20 what you would call full-time employees. In fact, maybe 3 of them are paid 40 hours a week full-time, and the other 12 or 17 really are working anywhere between 30 and 38 hours per week. So you're taking the hours total, you're not counting each of those 15 full-time people. You're not counting them as 15 full-time. You're counting up their hours, and for 1 week period, you're dividing that number of hours by 40. And just for that full-time, quote-unquote full-time set of staff, that's the number. The second set of people you might have 1 or 2 part-time people, maybe 20, a regular 20 hours a week, let's say. But you're going to have, a lot of you have 10 or 20 PRN or per diem employees who work anywhere from 4 hours to 20 hours in a week. And again, you're counting those hours as well. And you're taking that total number of hours for all the group of people, and you're dividing that by 40 hours, and that gives you the number of full-time equivalent employees during the week. Okay? And it is something you're tracking week by week. So you calculate the average monthly headcount, this is option 1, between February 1st, 2019 and to June 30th, 2019, or you calculate the average monthly headcount between February 1st, 2020 and February 29th. I'm sorry, that should be January 1st, 2020 and February 29th, 2020. So a 2-month period this year, or February, March, April, May, June, a 5-month period in 2019. Use one or the other option, okay, to calculate your baseline. That's what you are starting from. So then once you have that number, you look at, did you rehire all laid off or furloughed people by June 30th? If the answer is no, then your loan forgiveness is decreased based upon the difference in the percent difference in full-time staff this year compared to that last year periods we just mentioned. So this is what we gleaned out of how to look at option number 1, or forgiveness reduction number 1. Okay. The next option or the next method would be, and again it's either or, the next method would be to look at salary. So for that method, you look at the amount of wages or salary paid during the most recent full quarter. For example, March 31st, 2020. For each employee, that's the critical thing. You want to look at each employee. And again, you're looking at wages that are eligible wages, which is up to $100,000 a year. So if you have a person or two who are making more than that, you're only looking at the compensation rate of those making under $100,000 a year for each employee. So then you look at the amount of wages paid during the 8-week period after the loan, and then for each person, you're looking at the reduction amount, the dollar amount and the percentage for each person. I can't emphasize that enough. So then the question is, did you completely restore all decreased salaries by June 30th? If the answer is no, then the reduced loan forgiveness using a percent decrease based on the averages calculated above. So that's as best as we can determine how this calculation is going to work. This is one of the first processes we've seen that attempted to lay out the rules and how it's going to be done. We think more regulation and more FAQ is coming out on this topic. You know, the laws, I think the first effort has just been trying to understand how to apply for the loan, how to calculate your loan amount, how to determine if you're eligible for the PPP loan, affiliation rules, all those sorts of things. That's been the focus of FAQs up to this point. Really, the government hasn't yet really addressed FAQs on loan forgiveness. So this is the first shot at it. Recognize that, likely to change, but that's kind of how we see some of the calculations working when this thing ultimately happens, which is, again, going to be mostly 8 weeks from now or after June 30th, which is the end of the period where you can use the funds. So hopefully that's an explanation that helps people think about how they're going to walk through this. All right, I think we may have one or more other questions, so let me just pull that up. No, I think we've answered all the questions so far. Rita, do you have anything else to?
No, I want to thank the group for attending our call today. It's always a lot of fun to put this together.
It sure is. Thank you again for attending. We appreciate your attention. Hope you have a great day, and we will let you know the next time. Might be next week or the week after, depending upon how many other things come up in the next few days. So thanks again.
Thank you.
Have a great day.